our appetite. This also has an effect on our metabolism. Since it is no longer as well supplied with carbohydrates, it switches to burning fat. This creates energy-rich molecules called ketone bodies. And these may help our body to cope better with viruses. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to talk about impaired ketogenesis, which ties metabolism to T-cell dysfunction in COVID-19. At least that is what the results of the current study suggest. We found that patients with influenza infections produce ketone bodies in considerable quantities, explains Professor Dr. Christoph Wilhelm from the Institute of Clinical Chemistry and Clinical Pharmacology at the University Hospital Bonn, who is also a member of the Immunosensation2 Cluster of Excellence at the University of Bonn. In contrast, we saw hardly any increase in COVID-19 patients, at least in those with a moderate or severe course, he added. In addition, it was striking that those infected with the coronavirus had lower levels of inflammatory messengers in their blood. This was particularly true for interferon-gamma. The researchers also saw similar effects in another important group of immune cells, the killer T cells. Apparently, the ketone bodies promote the function of mitochondria, metabolic powerhouses fueling the immune cells. This not only ensures improved energy production, but also provides molecules that are needed for interferon production. Without an adequate supply of ketone bodies, on the other hand, the killer T cells and helper T cells show signs of exhaustion, Board explains. In this depleted state, they can no longer perform their function adequately. However, the researchers were able to revive the immune cells by placing diseased mice on a ketogenic diet, which is a diet low in carbohydrates and protein, or by administering ketone bodies directly. The results therefore also raised hope for new treatment options. It may be possible to increase the power of the body's own defenses through a targeted change in diet, says Wilhelm. However, the researchers expressly advised against self-experimentation with dietary supplements or diets. These could possibly do more harm than good. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.